Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Biostatics and Epidemiology. Let's get started with question number 1. For the following case. If a decision is made to test all newborns for this disease, then this initial test should be designed to have a high A. Cutoff value. B. Number of true negatives. C. Positive predictive value. D. Sensitivity. E. Specificity. The case scenario is: carbamoyl phosphate synthetase 1 deficiency is an inherited disorder characterized by accumulation of ammonia in the blood. The most severe form occurs in the first 24 to 72 hours following birth, after feeding begins and milk proteins start to be broken down in the liver. If left untreated, affected neonates often die due to severe metabolic derangements. Survivors often develop permanent neurologic injury. The estimated incidence of carbamoyl phosphate synthetase I deficiency is about 1 in 800,000 newborns. The question is: if a decision is made to test all newborns for this disease, then this initial test should be designed to have a high. Your options are A. Cutoff value. B. Number of true negatives. C. Positive predictive value. D. Sensitivity. E. Specificity. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is D, which is sensitivity. This question is designed with the focus to assess your ability to apply foundational science concepts. Carbamoyl phosphate synthetase 1 deficiency is a rare disorder, incidence 1 in 800,000 newborns, with serious and possible irreversible consequences if not detected and treated early. Therefore, it is important to identify all individuals who potentially have the disease using a screening test that can be performed on a large number of newborns. Although an ideal screening test would be highly sensitive and specific, developing a test that has both of these properties is often not possible, and so a compromise must be made. The sensitivity of a test refers to its ability to correctly identify those with the disease. It is the probability of the test returning a positive result in a person with the disease. A highly sensitive test will ensure that most patients with the disease will have a positive test result, leading to few false negative results. Therefore, fewer cases of disease are missed. Given a test with high sensitivity, a negative result would help to rule-cut a diagnosis. This is important during screening for life-threatening diseases, even if obtaining a high sensitivity causes an increased numbers of false positives. If you choose any option other than D, you are wrong. Let's briefly discuss the other options. A. Cutoff value. Setting a high cutoff value typically, but not always, produces higher specificity and lower sensitivity. B and E. Number of true negatives. And specificity. Specificity represents the ability of a test to correctly identify those without the disease. A very specific test has a low rate of false positives, so most healthy patients will have a negative test result, or true negative. Given a test with high specificity, a positive result would help to rule in a diagnosis. Confirmatory tests with high specificity are often used on patients who test positive on a screening test to ensure that a patient actually has the disease. C. Positive predictive value. Positive predictive value refers to the probability that a disease is present given a positive test result. Positive predictive value depends on disease prevalence. When screening patients for a rare disorder, positive predictive value will often be low due to a high number of false positives. Your take-home message from this question is that the sensitivity of a test refers to its ability to correctly identify those with the disease. A highly sensitive test should always be considered over a highly specific test when screening for life-threatening diseases, where identification of every person with the disease is important. Nailed the answer? Great! Click above to level up. Still learning? Rewatch and get it right next time. Understanding is your key to success. Unlock your USMLE and medical exam dominance with our awesome resources. Share the knowledge, hit that like button, and subscribe for medical exam mastery. Your future doctor self will thank you.